Our final set of health plan speakers join us from Horizon Blue Cross Blue Shield of New Jersey. We're so pleased to have Michael Considine, Vice President, Consumer, Small Group, and Midsize Markets, and Lara, Vice President of Marketing and Product Development, with us to share their experience today.
Okay, thank you very much and good afternoon. This is Lara, and we're very pleased to be joining you all to share our learnings. I'll start off with just an overview of the market factors as we were going into ACA, talk a little bit about our approach to our product and pricing strategy, and I'll turn it over to Mike, who can talk in more detail about our go-to-market activities. So just to start us off here, pre-ACA, Horizon had the leading market share in the individual marketplace, but it's important to note that these folks were primarily in our basic and essential plan, which was essentially going away with the advent of ACA because it was a non-compliant product. And so our challenge was, how would we retain the bulk of these members, knowing we were going to be launching new plans at higher rates? Also, we had pre-ACA specific plans that were already available to high-risk consumers, but those high-risk consumers in New Jersey were also going to be thrown into the same risk pool once ACA started. And the last point here is that we had about 1.2 million residents who were estimated to have no insurance pre-ACA, and all our forecasting, our work with public policy folks showed that we would expect about 161,000 of those to come into the exchange. Our focus then was really trying to understand the uninsured coming into the marketplace, and we did a lot of testing, conjoint research, a lot of product simulation, and similar to what other plans have talked about, the key findings we had here were, no surprise, the uninsured were really looking for affordable plans and simplicity, not just in terms of ease of use, but in terms of the number of plans available, and that certainly guided our decisions for the type of pricing and product portfolios. So given all our research beforehand, we intentionally went in with a very prudent pricing approach. We decided to price for the whole book. We did not make any specific assumptions about gaining a significant share, say, of young uninsured. And so we priced for a reasonable margin. Our view was it wasn't about a land grab at the onset. It was about creating a sustainable long-term business. And once we went into the marketplace in 2014, a couple of things, right? The first thing was that our pricing turned out to be much, compared to our competitors, our pricing was higher than we expected it to be with all our testing. So in other words, many of our competitors priced much lower than we thought they would. The second thing is, only about half of the uninsured that we expected to come into the marketplace actually signed up for plans. And so the net result of this was in our first year of the ACA, we only saw a very modest 6% membership growth, and Mike's going to allude to that a bit more later on. So for 2015, we sort of revised our posture to be more competitive but not reckless. And really, one of the ways we ensured we did this was we from the get-go, tried to stay with a very simple product portfolio. We only offered 5 products in 2014 because we knew that's what our consumers wanted. And we didn't offer any platinum products either until this year. And the gold we offered in 2014 was part of a tiered network, which brings me to my next point here. The McKinsey folks at the very beginning and a couple of the other presenters talked about how there's been a proliferation of narrow networks because of the price advantage it provides. We actually decided to go with a tiered network strategy, launched our first tiered network products, which had about a 10% differential versus our broad product. And then we created another product, also a tiered product called Omnia, which we launched last year. And so that now has a 15 to 20% advantage versus our broad product. And we think it offers the best of both worlds. It offers the lower premium, lower out-of-pocket costs that consumers are looking for, but still gives them access to the broad managed network that Horizon has here in the state. So all of those have really helped us. The membership has grown much better since our first year of ACA. But obviously, as with many other states, we're facing some new challenges as other companies are leaving, and so a lot is still sort of to be determined as we move into the next round with open enrollment coming up. So with that, I'll turn it over to Mike to go through some of the sales and marketing initiatives we've done.
Thank you, Ed. Good afternoon, everyone. This is Mike Considine, Vice President responsible for our individual, small group, and mid-sized markets, and great to be here today on this panel. I've really enjoyed the presentations preceding ours. I do want to mention a couple things that Ed mentioned that I think is critical important. Prior to ACA, we had a significant market share in the individual marketplace. So we feel that we were uniquely qualified. We had a strong expertise in that market, but also New Jersey is one of the more heavily regulated states in the country, and we were already in a guaranteed issue type of a climate. So while ACA had significant changes, we felt that we were in a unique position to be able to do well in that space. So in terms of what we did in terms of consumer engagement and go-to-market, we had several different learnings, and in terms of being much more consumer-centric as an organization. That was a big change for us. Historically, we focused a lot of our attention on the group markets and individual, but not really understanding from a consumer analytical perspective what they are in fact looking for. So what we did is we had a very robust consumer analytic program so that we were able to come out with a segmentation model. So therefore, we were messaging to the uninsured population in a way that would be specific for them. So for instance, our messaging campaigns to a young millennial would look different than an empty nester husband and wife or a coping family with 3 or 4 kids. All of their needs are unique, and we didn't try and treat them in a cookie-cutter approach from a marketing perspective. The other thing that we did is from where we reside here in New Jersey, we're between the New York and Philly markets. So therefore, for us to be spending extensive dollars in terms of radio and TV, it really wasn't in our best interest. We determined that the ROI wouldn't be there. So we focused an awful lot of our attention on outdoor, transit, social media to build awareness for the Horizon products as we started out in 2014 and 15. What we have done now is we have pivoted dramatically to a more targeted digital approach, direct mail, and using email for specific segments as we've been able to capture that type of information moving forward. In terms of where we spent a lot of our time, in New Jersey, about 30% of the uninsured population is actually Hispanic, Latino in the 21 counties in New Jersey. So what we did is we put a heavy emphasis on the Latino Hispanic marketplace. We launched a Spanish website, extensive grassroots efforts to try and sign as many of the Hispanic Latino members as possible, and we were very successful. We started out with about 8,000 members, and we finished OEP 2016 with over 30,000 members. In addition to that, what we did is in a joint venture, we opened up a Hispanic facility in one of the more densely populated cities called Jersey City in New Jersey that has been a great success in terms of onboarding Hispanic members, clarity around our message, product education, all of those things. And based upon that learning, we're going to be opening up in the next couple days a second site in central New Jersey in another heavily Hispanic area of the state. So that has been very important to us, and we will continue to move in that direction. Based on our data and analytics, also the Hispanic population seems to be a lower cost population than our overall population in the individual space. We essentially have blanketed New Jersey. We are fortunate in that we are a single state Blues plan operating for over 84 years. So we were able to leverage a lot of the great relationships on a grassroots basis throughout the state of New Jersey. We have Blue to You vans, they're called, and we have done hundreds of community events in all 21 counties of the state. We have another retail center that we opened up when ACA was launched back in 2014. So the face-to-face interaction is critically important, and the fact that we're solely located in New Jersey, we think that that gives us a great advantage. I think the greatest learning that we had, though, is in the area of retention of the membership in the IHC individual marketplace and the exchange. And I saw in one of the presentations earlier in terms of the need for constant value deliverables in the individual market. So they are absolutely the members doing the math on a monthly basis. They're paying for rent, for food, the premium, and it isn't an annual type of a retention effort. It has to be a monthly retention effort, and in fact, even a weekly retention effort. We have to demonstrate to the consumer member the value of having our coverage and all the value add components of that program so that each and every month they continue to make payments. Because if you're not showing the value and showing why it is so important for the consumer to continue with that program, we have seen it historically. They will make the determination that the value isn't there and they will lapse the coverage. So we have done all kinds of different things, invested heavily in technology. We've revamped our website, and we have improved our billing, our welcome kits, our education. We've done everything, and that has really delivered results for us in the second half of 2015 and 2016 specifically, where we have grown the membership from 168,000 to over 200,000 members. The retention persistency of those members is much greater than it was originally in 2014 and early in 2015. Ed mentioned, coincidentally, our strategy in terms of our product launch. Ed mentioned the Omnia product, a fee-for-value program. Right now, we have approximately 80% of all of our members on and off the exchange and individual that have taken this product. So this is a huge differentiator in the marketplace for us, and that has also enabled us to be successful. We've heard from some of the other panelists with regard to SEP, supplementary enrollment. We have been very, very strict requiring documentation. That in New Jersey we were more strict than our competitors, and therefore we may not have grown much during the SEP periods, but we also didn't take on the risk that some of our other competitors did in terms of being a little bit more loose in terms of taking on membership without necessary documentation. So that has been a great advantage for us too. So in closing, we have done well in terms of the marketplace. It hasn't been a panacea. We have gone down 2016 to 17. We're going from, there's 5 carriers. In 2017, we're down to 2. We don't think that's great for the consumer. We don't think that's great for the carriers. So we do believe that there are structural changes that are going to need to take place. But we are posed to once again provide affordable, quality care in all 21 counties in New Jersey in 2017. Thank you.